Okay na? Hello?
Nakikita na po.
Okay, so let's do the second part. So, by definition, forensic toxicology is the study of poisons. Forensic toxicology is a specialty under forensic chemistry, under forensic science, and there are forensic toxicologists from forensic scientists who have a bachelor forensic science degree, and those with masteral degrees, and those who have doctorate degrees in chemistry and forensic chemist. Okay. Now, it's the science that deals with the harmful effects of chemicals on human body, and toxicology is used for the purposes of law. Kagaya rin ng forensic medicine for the purpose of law. So, a drug is a substance which has a effect in the body, which is called physiological. When ingested or applied on the skin or inhale, inhale or being inhaled, uh, like carbon monoxide. So it's inhaled through your nose, and you will die shortly when the amount is sufficient for you to die, giving you a skin appearance when die cherry red skin, and even the autopsy, the organs, the lungs, the heart are all cherry red in color. Okay. So it has essential features. Okay. It is the most common non-natural causes of death. And the results are interpreted in the context of a thorough medical legal investigation, meaning there should be a history the, of the decedent uh, with exposure to chemical, uh, and it's necessary for the establishment of why the decedent died, and drugs are implicated. So, as we have discussed before, it shows the findings. Autopsy findings show only acute congestion and edema, and are generally non-specific. Okay. Uh, for the most part, they can give uh, uh, toxic chemicals level that may be contributed to the death, and toxic chemical levels, especially if they are known. Okay. And the postmortem redistribution in the body, uh, in the solid organs inside the body are the lungs, liver, myocardium, skeletal muscles, uh, and may affect the interpretation of substance levels. Okay. And they are present in the urine. Okay. Now, most common samples collected at autopsy are urine, blood, vitreous fluid, gastric contents, and liver. But most Indian forensic pathologists say that the gastric content and poisoning is, they are questioning that. But the practice where I worked before, they do get gastric content and put them pressed inside the container and put in a fridge or in the freezer before they are submitted to forensic scientists of the police force. Okay. Now, what are the terminologies in forensic testing? Okay. Forensic toxicology. Okay. So we have prescribed medications that those who have received a doctor's prescription to be used as prescribed on the prescription pad. However, there is a misuse of the prescribed medication when it's used in the overdose manner. They double the dose, okay? Or accidentally, the carer have given the prescribed person a medication that is double in dose or was given during, say, in the day, in the morning, and in the afternoon, when in fact should be given only in the morning. Okay. Over-the-counter medications. Those are pharmaceutical drugs that can be obtained without a prescription, like aspirin. Okay. For example, but not necessarily aspirin may cause um, illegal forensic testing endorsement, except that if it is taken in an overdose, it may cause acidosis, wherein there is the pH of blood is not alkaline but acidic. Okay, so recreational drugs that we see are those methamphetamine or for leisure, kagaya ng mga M, MDMA, legal and illegal substances. Cannabis, in some parts of Australia and overseas, cannabis is called legal, but the amount that you should carry should be only this much and not that much. Say you are allowed only to carry 4 leaves of cannabis. If you carry 10 leaves of cannabis, you are you will be fined and you may be in the future prohibited from owning any more cannabis. Okay, so drug levels, therapeutic and non-toxic. So what they are after in the therapeutic, yung mga given prescriptive medications, the drug concentration is to achieve a desired level in the body, like yung gaya ng antihypertensive drugs. So when you take them, it will lower the blood pressure of the patient who have a high blood pressure. Now, toxic drug levels, that those are the drug concentration when taken in an overdose can damage the body and can cause death. Yeah. Kagaya ng insulin, as we have said earlier, last meeting, that when you take too much insulin, if you are diabetic, to control the level of high blood sugar, sometimes the amount of insulin injected is over the dosage that you require. It may cause you lowered level of blood sugar or glucose and make you hypoglycemic, and you will be uh, having a condition resulting into coma. Okay? And the little one, that is over and above. the prescribed or drug concentration that we would like to have in a prescribed medication, and it is the minimum amount of drug that is supposed to cause death. As earlier, we have arsenic. Although it is not an illegal drug, it is a controlled drug. Uh, just a small amount can cause you some death events, but if you are taking that acutely in a greater amount, there you are, you will be surely dead. Okay. So screening tests, the ones urine is one of those used as screening tests, and it's called presumptive tests. Okay. Now, sa ating sexual assault investigation uh, cases, we do presumptive tests. Yung use of luminescence of the seminal fluid on a clot. If it is present, if it is become luminous, it is presumed to be seminal fluid, and further testing in the laboratory, a forensic laboratory, to ensure that it is really a dried seminal uh, fluid or substance. Okay. Next, postmortem redistribution. So by the time the autopsy is done, the poison may be redistributed in the body from the blood to the internal organs like the lungs, liver, heart, and skeletal muscle or blood after death. Okay, so they usually uh, go down from a high level in the blood into the organs that are mentioned. Okay, so certain drugs show level of blood after a few hours. Okay, so blood sample from a peripheral site like this seeing it femoral area are less likely to be affected than that from the central site, which is the body. Okay. Now, the greater the interval between death and sample collection, the more pronounced is the postmortem redistribution phenomenon. So, in terms of chemistry, that is not a direct proportion, but it is indirect proportion. Okay. So, usually, if it's a direct proportion, the more you study, the more you will pass, the more chance you pass. However, if it's an indirect proportion, the less you study, the more likely the chance of you not passing a subject, that is indirect proportion. So, multiple factors determine the postmortem redistribution phenomenon. Okay. So as we said before in the first part, the poisoning, we said that it depends upon the person taking up uh, a medication or taking up an illegal drug. It depends upon the height, weight of the person taking up, whether the patient is obese, fat or thin, old or young, those with previous injury to the brain, or those who have chronic medical condition as pneumonia, those having hypertension, those with the chronic diseases, those with chronic liver diseases. Usually, most poisons are dealt with by the liver. So if you have a diseased liver, you might be having a higher level of poison in your blood because the liver cannot tackle the detoxification of the toxic material or poison in your body because it is in the first place uh, a diseased liver, meaning sira yung liver o nasisira yung liver. Okay? Now, where are we? So, there are multiple factors, and among them is cell death. Okay? Cessation of aerobic respiration and promotion of anaerobic metabolism, loss of structural integrity, enzymatic leakage into the cytoplasm with progressive degradation of cellular components and leakage in extracellular material. Okay, so the more toxic is the poison, the more they will cause cell death. And therefore, when there is cell death, the poison is scattered from the dead cell into the tissues. That's why some of the poison can only be detected outside the tissues into the interstitial tissue, into the connective tissue. Okay. Next, decomposition. So, drugs are metabolized by microorganisms. Kaya pag nilibing na yung tao and it is decomposed, mahirap nang ma-detect usually yung poison. And subject to forensic investigations, forensics. Science of forensic biology or forensic chemistry. Okay. Passive diffusion from the stomach. So, yung nabanggit natin kanina, pag uminom ng maraming alak at saka kumain ng mataba, usually at the time of death, you can still see the alcohol inside the stomach but less in the blood because the fat inside the stomach delays the absorption of alcohol into the blood as pinag-usapan natin last time. Hey, so depends upon the substance properties. If they have high affinity for fat tissues, you can only find this substance in the body, in the fatty parts of the body, kagaya ng anesthetic drugs. They are usually found in adipose tissue, which are fatty tissues. Yung mga those found inside under the skin. Yung pag inautopsy mo yung medyo matabang tao, pagbukas na pag-flap mo ng skin, may makikita nga yung yellowish tissues underneath the skin. Those are the fat tissues and they may hold much substance that have high affinity. Poisons with high affinity for fatty tissues. Okay. Now, fatty body position after death. Sometimes the material that is present should be in the stomach. However, kagaya ng mga lasing, pag nalasing, nawala ng malay, tapos biglang namatay, alam nating uminom sila kagabi, pero nung pagkamatay wala sa stomach content yung alcohol at wala sa blood yung level ng alcohol to be at the level to be detected at the forensic science laboratory. It is because isinuka ng tao yung alak. Usually when they are lasing na lasing, pag walang malay at medyo pataob ang tulog o medyo nasa side, sumusuka sila, pati yung kinain, pati alcohol, isinuka. Okay. Next. You right there? Hello? Hello?
Yes po.
Oh, buhay pa? Okay. Next, specimen collection. So the specimen collection and the reliability depends upon the quality and quantity of the urine sample. So it depends upon the sensitivity of the forensic test that is being used for detecting a certain chemical and the amount that the forensic scientist or the doctor submitted for examination. So if there are smaller amounts, it may not give a true value for a positive uh, determination or identification of the chemical. So samples collected should be as soon as possible after death. Dapat hindi na embalm yung katawan. Yung embalming ng katawan, lalo na sa forensic cases, ay naging issue lagi ng mga nakaraang taon yung kung bakit ini-embalm yung tao. Fresh naman nung namatay, pwede naman gawing autopsy agad at makakollect na specimen for chemistry, for prescribed medication, for alcohol, for cannabis, for methamphetamine. And sabi nila, it's not possible in most cases. Body refrigeration minimizes the postmortem processes. Some should be refrigerated, some should be frozen. Hospital samples may be available doon sa mga namatay sa poisoning that was collected inside the emergency room or on day one when the specimen was collected on patients on day one of admission before they died in serious cases. Now, most common postmortem samples and collection methods: femoral blood, just singit. Yan. Sa living persons, usually it is done frantically if you cannot get blood from the hands or dito sa antecubital fossa ng arm. Sa autopsy, it is can be collected only before the autopsy is done by a local dissection and considered to be the most reliable specimen for postmortem analysis. Ako kumukuha ng dugo dito sa baba ng ah, clavicular bones sa left and right. Okay? Urine. Bago autopsihin, gagamit ng large bore needle. Ko-collect ng blood sa urinary bladder. Sa autopsy, after dissecting urinary bladder, vitreous fluid, as we have said before, can be collected from both eyes, gastric content, liver, okay, less common on the following organs. Insects, especially they're found bodies found dead on the field. So, maggots fly larva. So by the time you are employed in forensic laboratory, forensic toxicology section, forensic chemistry, forensic biology, you will learn on the job training on how to use storage of specimens collected, especially fresh specimen, blood, urine. Okay. So in chain of custody protocol should be properly observed and preservation of the specimens are being taught to you when you do observation training or being employed in a forensic toxicology laboratory. So this is sample of cocaine and um, so cannabis or cocaine pa rin to. Ayan, cocaine. Well, cocaine yata ito o methamphetamine. Yan. Yan. And lately, ito na picture to sa magazine dito. It's about fentanyl. Okay. Yeah. Fentanyl, the previous president used fentanyl for his condition, whatever it was. So fentanyl is cheap and can be manufactured easily, and it's 100 times stronger than heroin. So mga drug cartels would like to manufacture that. Okay? Yeah, fentanyl kills one American every 7 minutes. Eto yung tao, ewan ko, celebrity yata yan. But he survived fentanyl. And how she is still living. I think she is from United Kingdom or United States. So summary, we have discussed drug testing, and important is at the end is protocols of chain of custody should be observed, and after that you will make a report which you will present just in case you receive a subpoena. Okay. So when you receive a subpoena, you need to bring official toxicology result or maybe autopsy result, and you should bring into the courtroom your copies of your diploma. Sometimes they ask that what are your qualifications and what can you give us your ID, who are you and why you are here, and you must present a subpoena that was sent to you. You present the subpoena that you are the said person that is being mentioned the subpoena, and that you are representing your agency, NBI, PNP, PDEA, BGMP, fire, fire department, or whatever. And these are the references I use. Pathology outlines, website, Night's Forensic Pathology, Handbook of Forensic Pathology, Weekend Australia magazine last week, and the future of drugs are the designer drugs, which the forensic science laboratories may not be able to keep up to detect properly, because designer drugs, kagaya ng mga damit yan, so, sari-saring itsura ng damit, sari-saring itsura or ingredients ng illegal drugs that are toxic, that can cause death, that can cause mind-bending episodes, that can cause you drop dead at the same time easily, that can make you see something because you have hallucinations, whatever. Okay.